you're making this impact here locally, of course, but also globally, other parts of the world. I mean, tell us about the work you're doing in your mission here.
Yeah, so I've been fortunate enough to work with a foundation called FACES Foundation since 2012, and I've been doing global health international surgical mission trips to do cleft lip and palate surgery since that time in rural Peru. And this a phenomenal group. I also recently joined a group called Operation of Hope, and I go to Ecuador, and then this coming year I'll be going to Zimbabwe to do cleft lip and palate surgery with them as well. And that's, anyone who knows me knows I have a passion for improving access to care and treating underserved. So this is one of, I think, the best things that I do, and is really good soul recharging for me every day.
That's wonderful and soul recharging for you, but you're benefiting so many people. It must be so satisfying. You're sharing your expertise with others. What do you think surgeons and patients are able to take away from this?
Yeah, I think surgery is the easy part of mission trips. The hard part is that you're in a resource-limited environment, and the team that it takes to make this happen with so many challenges and barriers. You have like-minded people that come together, and their whole goal is to take care of children. And they will find a way around it, and we work with local politicians. It doesn't matter what your culture, your language, your religion is. Everybody has that same goal. And so for me, it's really impressive to see that happen, that coordination. And for patients, I mean, you're changing their lives. And for us, it's something that we do every day, and it's an expectation in here in the United States, but globally it's not. So you really make a huge impact for families and communities.
And you mentioned how this just really recharges you, and it must be so rewarding. You learn while you're there, right?
Absolutely.
So that fills you up too. What is the most rewarding part of this, or what is your takeaway from this?
Yeah, I think having the whole group come together with that same common goal and just break down any barrier that there is to provide this care, but also to try to create a sustainable and comprehensive care program. So I don't just want to go in and do a surgery and leave and never come back. I don't know what happens to that child. And many of them need surgeries throughout their lifetime in speech therapy and care, dental care. So forging relationships and creating those partnerships in whatever country we go to and allowing us to really provide that high quality comprehensive care. And then I get to work with amazing surgeons and physicians who really want to take care of these children and will give up their time and energy and have a lot of
people's hearts.
Yes.
Like just how beautiful and how lovely that is. And as you've expanded globally, I mean, you've also expanded here locally in Central PA. Patients can see your team all over now.
Yes, and we are still actively expanding. So currently you can see us in Lancaster. We are at multiple outpatient offices across central Pennsylvania. We're working towards expanding into Reading. For specialty services, you can see us in Harrisburg and sometimes in the West Shore, depending on services needed. And I think what's really exciting is members of our team are working on developing a mobile unit where you can go into more rural communities who really have poor access and do hearing and speech screening. So that's really an exciting thing that's coming down the pike.